Hey, I'm Dr. Sage, and I'm a board-certified neurologist. I've spent the last 17 years treating stroke patients, and I need to tell you something that could save your life. Here's what keeps me up at night. About 80% of strokes are preventable, but most people miss the warning signs. And here's the harsh reality. According to the American Heart Association, the average stroke costs around $140,000 in medical bills, not to mention the loss of independence. But here's the good news. Your body often sends warning signals before a major stroke hits. If you know what to look for, you can prevent it. So hit that subscribe button right now, because I'm going to walk you through the real evidence-based information you need. All right, let's talk about what's really happening before a stroke. You've got blood vessels. Think of them like highways that carry oxygen to your brain. A stroke happens when one of these gets blocked, usually by a blood clot. But that clot doesn't just appear out of nowhere. Here's what you need to know about the two main causes. Number 1. That's when your heart beats irregularly. When it quivers instead of pumping normally, blood can pool and form clots. According to the American Stroke Association, AFib increases your stroke risk by 5 times. Number 2. That's fatty deposits building up in your blood vessels. A 2018 study in the journal Circulation found these plaques can rupture suddenly and trigger clots. Now here's the critical part. The warning signs you might be missing right now. I'm not just talking about the big ones like not being able to move your arm. I'm talking about TIAs, or transient ischemic attacks. People often call these mini strokes. They might only last for 5 or 10 minutes. You might feel a sudden numbness in your hand, or a weird tingling in your face, or maybe your vision goes blurry for just a moment. And then it goes away. You think, oh, I just sat on my hand wrong, or I'm just tired. Do not make that mistake. A TIA is a medical emergency because it's a warning that a massive stroke is coming. In fact, a study in the journal Stroke showed that 1 in 10 people will have a major stroke within 90 days of a TIA. Now, let's talk about some other signs that are easy to brush off. Sudden dizziness or loss of balance, difficulty swallowing, or a sudden, severe headache with no known cause. If you experience any of these, even if they only last a few minutes, you need to call your doctor immediately. Another big one is blood pressure. It's called the silent killer for a reason. According to the Mayo Clinic, uncontrolled high blood pressure is the one leading cause of stroke. And if you're a smoker, listen up. Smoking thickens your blood and increases plaque buildup. Quitting today, even if you've smoked for 40 years, can cut your stroke risk by 20%. Here's what I want you to do in the next 24 hours. Action number 1. Take your pulse for a full minute right now. Is it regular? If not, call your doctor tomorrow. Action number 2. Check your blood pressure, either at home or at your pharmacy. Most have free machines. Action number 3. Think back over the past month. Have you had any of those warning signs? If yeah, call your doctor tomorrow morning. Write it down right now. Action number 4. If you're on medications for your heart or blood pressure, are you taking them exactly as prescribed? If you've been skipping doses, talk to your doctor. Action number 5. Hit that like button and share this video with someone you care about. Look, you've worked too hard your whole life to lose your independence to something preventable. Your family needs you healthy. Your grandkids need you there. You've got more control over this than you think. Most strokes are preventable if you take action. Important disclaimer. This video is for educational purposes only. It's not medical advice. And I'm not your personal doctor. Always consult with your own physician before making changes to your medications or treatment. If you're experiencing stroke symptoms, right now, face drooping, arm weakness, slurred speech, stop watching and call 911 immediately. All right, I'll see you in the next video where we're talking about blood pressure mistakes. Make sure you're subscribed. Take care of yourself. Your family's counting on you.